Trump humiliated as vaccine restrictions spark legal chaos nationwide. It's a headline that perfectly captures the dangerous intersection of politics, science, and raw power. The United States is once again reliving a familiar nightmare. A public health system undermined not by viruses alone, but by the very leaders who should be protecting it. RFK Jr.'s restrictive vaccine policies have now become Trump's political shield, and the fallout has been immediate. Top CDC officials forced out, legal uncertainty spreading through every hospital and pharmacy, and millions of Americans suddenly left in limbo. This video will argue one central thesis. Trump's decision to support RFK Jr.'s sweeping vaccine limits has not only destabilized the CDC, but also created a nationwide legal quagmire that endangers public health, erodes trust in science, and exposes his own political vulnerabilities. In plain terms, this is a crisis born from opportunism, and the humiliation Trump now faces is entirely self-inflicted. Here's the roadmap. First, we'll explore the political climate and explain why Trump aligned himself with RFK Jr., despite knowing the risks. Then we'll dive into the most critical consequences of these vaccine restrictions, from collapsing access to care, to lawsuits against doctors, to the hollowing out of the CDC. Finally, we'll connect these events to the broader implications for American democracy and examine what this chaos means heading into the 2024 election cycle. The stakes couldn't be higher. This isn't just about vaccines. It's about whether truth, science, and law can withstand the weight of political gamesmanship. To understand the legal chaos unfolding now, we need to step back and examine the political climate that led us here. The United States has long been divided on vaccines, but the pandemic hardened those divisions into partisan battle lines. Under Trump, skepticism toward public health institutions became a rallying cry. By the time RFK Jr. stepped into a position of influence, the ground was already fertile for dismantling established vaccine protocols. Trump's embrace of RFK Jr.'s restrictions wasn't accidental. It was a calculated play to appeal to his populist base, even at the cost of public health. The key players in this drama reflect the collision of science and politics. At the center is Donald Trump, who sees RFK Jr.'s vaccine skepticism as a tool to energize voters distrustful of government authority. RFK Jr., in turn, has been waiting years for an opportunity to implement his anti-vaccine agenda, framing it as a crusade for freedom of choice. But inside the CDC, professionals like Dr. Susan Mons and other senior officials understood the stakes. Restricting vaccine access would not only endanger lives, but also expose doctors and pharmacies to legal peril. When they resisted, they were forced out, creating a leadership vacuum at the very agency tasked with protecting Americans during a pandemic. The stakes could not be clearer. Thousands of people continue to be hospitalized for COVID each year, even as new variants emerge. By limiting access to vaccines, Trump and RFK Jr. have triggered a dual crisis, a public health setback and a legal minefield where doctors risk lawsuits simply for doing their jobs. It's not just bureaucracy at stake, it's the nation's ability to respond to the next wave of infectious disease. The first and most immediate effect of Trump backing RFK Jr.'s vaccine restrictions is the collapse of straightforward access to life-saving boosters. Until recently, Americans could simply walk into their local pharmacy and receive a COVID booster. No appointment, no prescription. This system was efficient, accessible, and trusted by millions. But under the new policy, that access has been gutted. Adults under 65 can no longer receive boosters without a doctor's approval, and pharmacists, who serve as the primary vaccine providers in many rural and urban communities, are legally barred from administering shots outside the new limits. The evidence is clear. According to CDC data, more than 70% of vaccinations in recent years have been delivered through pharmacies. Restricting their ability to administer vaccines is not a minor change. It's a chokehold on the system itself. And the timing couldn't be worse. New COVID variants continue to circulate, and hospitalizations remain steady, with thousands still admitted each week. By supporting RFK Jr.'s changes, Trump has effectively weaponized bureaucracy to block access, creating a scenario where the very tools meant to protect us are locked away behind unnecessary red tape. The analysis here reveals the deeper strategy. Trump and RFK Jr. are not simply reacting to medical data. They are shaping policy through ideology. By framing vaccines as something that should be rationed or restricted, they feed into a narrative of distrust in science. But the price of this political maneuver is chaos at the ground level. Parents unable to protect children in multi-generational households, the immunocompromised left vulnerable, and working-class families forced to navigate costly doctor visits just to access what used to be routine care. The second devastating consequence of Trump's support for these restrictions is the creation of a legal minefield for healthcare providers. Under RFK Jr.'s directives, doctors who prescribe boosters outside of the newly defined FDA indications are now at risk of lawsuits. Imagine being a physician who believes, based on the evidence, that a 40-year-old patient with diabetes should receive a booster. In the past, that decision would have been protected as a professional judgment. Today, that same doctor could face litigation for defying the political dictates of Washington. The evidence from the source material is stark. Doctor. Vingupta warned that these changes open providers up to lawsuits simply for prescribing vaccines in line with established science. In legal terms, this shifts the burden of proof away from evidence-based medicine and onto political decree. The chilling effect is immediate. Doctors will hesitate, pharmacists will refuse, and patients will pay the price in uncertainty and delay. The analysis shows why this matters. Trump's embrace of these policies is more than symbolic. It creates a nationwide legal framework where science is no longer the final authority, lawyers are. This undermines the Hippocratic Oath itself. If every medical decision must be weighed not only against clinical data, but also against potential lawsuits, then the integrity of the healthcare system collapses. Trump has not just politicized public health, he has turned it into a courtroom battle where ideology trumps expertise. The third consequence may be the most far-reaching: the hollowing out of the Centers for Disease Control and Prevention. Within weeks of RFK Jr.'s restrictions, the CDC director was ousted, and senior officials from the vaccine unit, zoonotic disease division, and medical leadership resigned in protest. These weren't faceless bureaucrats. They were experts with bipartisan credibility, many of whom had served across multiple administrations. Their resignations leave a vacuum that is difficult, if not impossible, to fill quickly. The evidence is undeniable. The Washington Post confirmed that Susan Mons, the CDC director appointed just months earlier, was forced out because she refused to bend to RFK Jr.'s demands. Others followed, unwilling to sacrifice science for politics. The loss of expertise at this level is catastrophic. These are the individuals responsible for coordinating responses to zoonotic diseases like avian flu, Ebola, and COVID itself. Without them, the nation's frontline defense against future outbreaks is crippled. The analysis here points to a dangerous precedent. By replacing expertise with political loyalty, Trump and RFK Jr. have set the CDC on a path toward irrelevance. The agency once revered worldwide is now seen as a political battleground. The long-term effects are profound. International partners may lose trust in U.S. data. State governments may chart their own conflicting paths, and ordinary citizens may no longer believe any federal guidance. Trump may think he has scored a political victory, but the humiliation lies in the reality. His endorsement has hollowed out the very institution meant to protect American lives. There's one additional element that underscores Trump's humiliation: his silence after the domestic terror attack on the CDC building. Armed with rhetoric drawn directly from anti-vaccine movements, a shooter targeted the CDC, killing a police officer. Yet Trump offered not a word of condemnation. No statement of sympathy, no vow to protect the agency. Silence in this case spoke volumes. The evidence from the source is chilling. Hundreds of bullets riddled a federal building, yet the former president remained mute. The analysis points to complicity. By refusing to condemn violence, Trump tacitly validated it, emboldening extremists who now see public health institutions as legitimate targets. This silence intertwines with his political strategy. Destabilize the system, let chaos reign, and reap the benefits of fear-driven loyalty. But the humiliation comes when the costs become undeniable: loss of life, destruction of trust, and a nation asking why its leaders refuse to defend their own institutions. Together, these layers of analysis reveal the full scope of Trump's humiliation. He tied himself to RFK Jr.'s anti-science crusade, and in doing so, triggered a nationwide collapse in vaccine access, turned medicine into a legal battlefield, gutted the CDC of expertise, and silently validated violence against public health. This is not just a policy misstep. It is a historic failure of leadership. The humiliation Trump faces over these vaccine restrictions is not confined to the walls of the CDC. It signals something far more dangerous for the American political and legal system. By endorsing RFK Jr.'s policy, Trump has effectively normalized the idea that science can be dictated by ideology, not evidence. This erosion of trust in public health institutions carries ripple effects that extend into every sector of governance, from how schools handle outbreaks, to how courts adjudicate health-related lawsuits, to how states coordinate during crises. The bigger picture reveals a weakened United States at precisely the wrong moment. Globally, infectious diseases do not respect borders. If the CDC is seen as compromised or hollowed out, international partners may hesitate to rely on American data, undermining cooperative responses to pandemics. Domestically, the legal chaos already emerging, doctors facing lawsuits, pharmacists barred from acting, creates a two-tiered system where only those with money and access to private physicians can secure basic protections. Looking ahead, the 2024 election cycle will almost certainly amplify these divisions. Trump may try to wield the restrictions as proof of taking control of government overreach, but the backlash is mounting. Rising COVID hospitalizations, preventable deaths, and escalating lawsuits are not abstract issues. They are real crises that voters will feel in their communities. If unaddressed, this could become one of the defining failures of Trump's political legacy. Trump's embrace of RFK Jr.'s vaccine restrictions has left behind a trail of chaos, legal, medical, and political. The humiliation he now faces is not only because of the policy itself, but because of its consequences. Collapsing vaccine access, lawsuits targeting doctors, the mass resignation of CDC experts, and a silence that emboldened violence against public health institutions. The thesis is clear. When politics overrides science, the result is not strength, but instability, and Trump has exposed the nation to both. This episode should force Americans to confront a sobering truth. The fight over vaccines is no longer just about health. It's about the rule of law, the integrity of science, and the survival of institutions that safeguard our lives. Trump may frame this as a win for freedom, but the reality is a loss of trust, expertise, and security. So here's the question for all of us. Do we want leaders who turn medicine into a political weapon, or do we demand leadership that protects public health above all? If you found this analysis valuable, hit the like button, share this video to spread awareness, and don't forget to subscribe for more in-depth breakdowns that go beyond the headlines. The stakes are too high to stay silent.